Good evening. Thank you for joining us. I'm Greg Glover.
And I'm Cindy Sexton. Measles cases are spreading in the U.S. and an unvaccinated child died this week in Texas.
Over the past few weeks, cases have also popped up in Georgia, and that sparked some concern. Local 3's Catherine Vaughn has this story about this year's outbreak.
As of late February, the CDC says the number of measles cases in the United States has reached 93, most of them affecting unvaccinated children between 5 and 19 years old. 1/4 of those has resulted in hospitalization, and on Wednesday, Texas reported the first death from the virus in over a decade. But what we're seeing now is not uncommon.
In the 90s, in 1990, we had 28,000 cases of measles here in the United States. And then in 2000, we declared it eliminated. But still, since 2000, we've had a few dozen cases off and on since that time.
We've seen the virus emerge in 8 states, one in our area. Dr. Gary Vocchio with the Georgia Department of Public Health says his state's lower vaccination rate is concerning and may play a role in the number of cases they're seeing.
In Georgia, it's 88%. So we are underneath what's called herd immunity, which is very troubling to me as a health professional and a public health doctor.
This means 12% of people are not vaccinated. That number is just 5% in Tennessee. Vocchio says it's important for everyone to take precautions and get both shots.
These vaccines save lives. They are highly protective, and I strongly recommend parents make sure their children are vaccinated.
The CDC says measles can cause serious complications, especially in younger children. If you get infected, Dr. Vocchio says you won't feel the effects until 1 or 2 weeks after making contact.
And 3 to 5 days after those symptoms begin, they get spots in their mouth called Koplik spots, and they're very particular to the measles. They're little white spots and specks in the children's mouth.
In the days following, you'll notice changes on your skin.
And then the rash occurs about 7 days to a week after, with this diffuse red flattened rash throughout the body.
Dr. Vocchio hopes every parent will take the threat of measles seriously and talk to their doctor. I'm Catherine Vaughn, Local 3 News.